Good morning, everyone. Please settle down. Nice to see that most of you are back for this class after your supply exam and whatever. So I'm just going through what I taught in the last class, just for a refreshing. Okay. So this is what we are going to talk about. Today's topic is about census, basically. So last class was this. So I'm just going through this. What is demography? Study of the population, which includes study of changes in population size, composition and distribution. Demo means people, graphy means measurement. This we have all talked about in the last class. For those who were not present in the last class, okay. So why do we need demography? For planning of health services. How many hospitals are required? How much immunization is required? How many other things are required? Okay. And what type of manpower is needed? How to distribute them? So this again, age, sex, composition and territory. Like the hill areas, obviously the population is less, whereas the urban areas are more crowded. Now this is the main topic, the sources of demography. How do we get a demography? From these four main points. Census, then you have National Sample Survey Registration, SRS, and vital events. Now census is the biggest source on demography, and not only demography. Sources for economic activity, literacy, education, housing, household, urbanization, fertility, mortality, SC, ST, and language, religion and minority. So when you go to a house for a survey, it's not just 5 minutes affair. So you have to take a long form and get all this data. So you need, what do you need? For doing a census, what would you need? What would you need if you need a census? To do a census, what would you like? Blue shirt. A blue shirt. Ki lagbe? Census korte? Census korte ki lage? What do you need to have a census? Huh? What are the people you need for a census? Ki korbe census? Government worker. Okay. Government worker koto dene korbe census. Very good. Kon government worker? The state government কোন worker? ঠিকই বলেছো গভর্নমেন্ট স্টেট গভর্নমেন্ট ওয়ার্কার কোন ওয়ার্কার? It's not easy. ঠিকই বলেছিস state worker government worker has to do it, fine, but it's not easy. He has to be literate. He should fill up the form correctly. So usually the job is given to some teacher or somebody who knows the thing. Okay, so কাজটা সোজা নয়. So here we are looking at all these factors: fertility, mortality, marriage, migration and social mobility. Now, this is where you talked about this also. Now this is census. We had the last census in 2011. Every 10 years the census held. Now census was not held in 2021. Why? Why was it not? COVID, yeah. Okay. Actually, you can see here the picture. The team is there. They're recording data. Puro gram chule ase. Now I want to ask you, how many of you are from outside West Bengal? How many of you from outside West Bengal? Only one person. Nobody else. 2, 3, 4, 5, 6. So, are you scared of the census? Not scared of census. I am scared of census. Why? Why am I scared of census? Bolo? If there was no census in 2011, and tar aage census hoise. That's old census. My name is there. My house is there. My parents were there. Today my parents are not there. Today I am here. My family is somewhere else in Kerala. So when the census people come, they will not find, they may find the house locked. They will find nobody is there. Nobody is there to give data. So rakhi korbe. They are supposed to go and revisit the place. Revisit korleo, they may not find anything. So the problem is that my name may not be in the census. Some of your friends also may not be in the census. We don't know when the census people are coming. They're supposed to come anytime. The Kobe asbe, we don't know. Ajke aste pare, samne robbar aste pare. Like, so that particular time if you're not there, no issues. But that estimate of calculation may be wrong. Okay? Second thing is, nowadays everybody is linked to mobile. They can call you, okay, you mobile, they might ask your neighbor, you know the mobile, phone korbe. Yes, then they'll ask you same questions, all these things. But the problem is that there may be a mismatch in the census this time. Okay. So this is the census in progress. This we are not going to demographic cycle, high stationary early expanding, late expanding. High stationary, high birth rate, high death rate. Till 1920, India was in that state. Early expanding, the death rate declines, birth rate is unchanged. Late expanding, death rate declines further. And this happens in birth succeed death. Okay. Low stationary, low birth rate, low death rate. Industrialized happens in industrialized countries like Austria, Sweden, Denmark, and Belgium. The advantage with this low birth rate, low death rate, as far as the government is concerned, is that is why people want to migrate to such countries where population is less. Nobody wants to migrate to India where population is so much. So because of this. And some countries like Germany, they have a birth rate which is lower than death rate. So this is the world population trends. This we will not go into this. So what are the reasons for birth rate and death rate being less? Generally the health system has improved. People are living more. A lot of food production is there. Food supplementation is there. Vitamins, and also family availability of contraception, education, and change in marriage patterns. Previously, girls used to get married at 15, 16, 17. Now girls are not willing to get married even at 29 years. Okay. Then successful immunization, improvement in maternal and child health services, diarrhea and respiratory control system, reduction in infant mortality. These are reasons for the declining birth rate and the death rate. Last class I put fertility rate and all that. We will not go into this. So this is important. These things you have to remember. Crude birth rate, crude death rate, general fertility rate. The rest of the things you don't bother. Crude birth rate, number of live births per 1,000 India population. Crude death rate, number of deaths per 1,000 live year population. These two things are very important. The other things are not important for your MBBS level. For later level, it's important. So we are now the second most, the biggest population actually. And so this is the pyramid. We have a pyramid in which we are having a tapering base. Tapering base means we have a large population which is dependent on others for money, economically, and we have a top which is also thin, elderly population. Okay. Other countries have a bulging pyramid. So now we'll go to the main thing today. Once in how many years census occurs? 10 years. So 10 years in Machkane Kichule, what do we do? What will you do? So suppose there's no data in between 10 years. What happens? What happens if there's no data for within 10 years? 10 years is a big time, right? है कि ना? 10 years famine होते पारे, flood होते पारे, tsunami होते पारे, COVID होते पारे, अनेक किसी होते पारे. So in between what happens? In between how will you get the data? So you wait for 10 years. Class 1 है तुम्हें ढोके तार पर class 10 है तुम्हारा census होच्छे. जब बात करने की होच्छे nobody knows हास्चे. So what will you do for in between data? What will you do in between? Anyway, so for that we have what is called a sample registration system, SRS. Okay. So till recently, till 1960s probably, birth and death registration was not made compulsory. Why? Nobody's bothered. Gramer log they don't bother about it. Janmo hoyeche mishti khawalo shobaike. That's it. But after 70s, it became very important. After 68, it became very important for everybody to get the birth and death registered, without which nothing progresses. Why is birth registration important, Bola? Why do you need a birth registration? Why is the birth registration important? Why is birth registration important? Tell me. For what is birth registration important? Birth rate, no, what sadharan, don't talk about big things, talk about small things. Birth certificate, kya dorkar? Huh? Identification, what identification? Identification, yes, what identification? He's saying identification, birth certificate is for identification. Sir, what is birth certificate required for? Identification is for identification. What else? What else do you all use while you use the birth certificate for? Huh? Age, yes, age. Age is for what? Why do you need age? Age can, Prathame, in your life, what is the age first done for? Bola? What do you use the age first? Huh? Huh? Accident? Huh? Vaccination aage, much before vaccination. Vaccination, you agreed. Or something which all of you have done, including me. Huh? Then the birth rate is much later. Birth rate, no, simple thing. Much simpler. School, some okay, school. Yeah, good. School bhorti korte, you have to have a minimum age. 4 years or whatever is the age. 2 bochor bachcha ke play school, crash, but for a basic thing, that is the first thing. So without the birth certificate, you will not be admitted to school. Now previously, badite janma hoyeche, nobody used to take a birth certificate, but now first thing is birth certificate kothay. That is the first thing. Birth rate, all that will come later. Similarly, why is death certificate important? Why is a death certificate important? Patient to more tak. What is it? Why is it important? Why is the death certificate important? Huh? Huh? Why is the death certificate important? Tell me, huh? Huh? What? No, why is the death certificate? Birth certificate for getting admission in schools right from the basics. Death certificate, why is it important? Bolo? Use your basic, huh? Cause of death, to theek ache. Cause of death to the matha ghamacchi na kon. What else? You know that paper podcho, news podcho. News podcho ki podcho na? Ba khabar rakcho. So I heard the words of election hai. Mora log other voters list naam ache. That is one thing. Second thing is regarding property. Somebody has died, his property has to be divided. Then they will ask who is the son, who is the daughter, property. So then they will ask where is the death certificate. Suppose somebody's grandfather died, he wants to transfer the house to the son. Kintu, you have to prove that the grandfather died, number one. Next is, for that you need the death certificate. Will till sheda alada paper, but for that you need the death certificate. So that's why birth certificate and death certificate are very important and they are made mandatory. Okay. So that is the thing in sample registration system. So more or less in the villages or everywhere, pura jane je ke janmo hoyeche ke more geche, and that is done throughout in India. So the problem is that it is not done regularly. I mean, it's done every 6 monthly. Okay. So that is called sample registration system. Apparently I can't locate it over here, though I downloaded it in there. So second thing is that it said is national NS, what is it? Yeah, sample registration system. So that covers the births and deaths. So what happens here is one team goes to the villages or the places and records all the births and deaths. And again after 6 months, another team comes and verifies it. So obviously you cannot do it in, as I said, somebody said census. Census is a very big thing, and not only does it include births and deaths, it also includes a lot of other data. What is the data it includes? Family size, religion, education, occupation, income, a lot of things. A normal visit to a census will take, to a house will take at least, one house might take half a day, okay, if it has so much of data. On the other hand, this SRS or sample registration system is they have to take a sample. They don't take everything. Census, every house is covered. Every dwelling place is covered. But in sample registration system, what happens is a sample is taken. So, say for example in Birbhum district, the population is, I'm giving an example, 5 lakhs or 10 lakhs. So out of 10 lakhs, they will select maybe 10 villages. And in the villages, they will select a few houses, and that is where they will do it. So not few houses, not that for that. This is for sample registration. So those 10 villages only will be selected for that sample. That's why it's called sample registration system. I'm just giving the example of 10. It may be more. And there, that data is extrapolated. That is, you're multiplying the data for the entire district. That is done once, and after 6 months, again, somebody goes, a supervisor goes and finds out whether data is correct or not. Why is the data is correct or not? Sometimes there may be fake data. They say that person was born They get some benefits. They saying the patient was born. And sometimes they say the patient is dead again to get some benefits. And a lot of false things happen in India. I'll give you an example. My auntie, she's 84 plus. My uncle died actually a few years back. So he had a pension from the Air Force. So my auntie wanted to get the pension. So the Air Force people, the defense board which gives the pension, they said, we'll give you the pension, but you produce a certificate, marriage certificate. Now, they asked for the marriage certificate of my auntie and uncle 50 years back, more than 50 years back, but there was no marriage certificate. So they said, how to get the marriage certificate? So they said, no, you have to get the marriage certificate. Then they said, okay, we don't have the marriage certificate. 50 years ago, there was no marriage certificate. Then they said, you get two people who attended the marriage within the issue, or you get a invitation card. 50 bachar aage ka beer invitation card. So my auntie said, how will I get it? So then they said, madam, there's a lot of false things calling jali hocche. We need this to prove that you're the real widow of so and so. And they're not accepting joint account. They're not accepting Aadhaar card. They want this proof. Finally, she had to get an affidavit and all on a cost page. So what I'm trying to say is there's a lot of falsehoods. This verification is there. National sample registration system. Somebody goes first, and after 6 months, again, they verifies it. So that is why births and deaths are very important. They only look at births and deaths mainly, and based on that, they calculate the crude death rate, crude birth rate. Some districts may have a high birth rate, some districts may have a low birth rate. All this is calculated in the sample registration system. The third one is the NFHS. Now NFHS is again, it's like the census, more complicated. You need trained persons to do it. And what is the problem? Somebody who the government people can do census, right? So who are the people who do you think would be the people to do census? Primary school, very good primary school teachers. So the primary school teacher 8 crore. So you're right, primary school teachers can do it. Secondary teachers cannot do because they have like madhyamik evaluation, etc. So main issue is you have to have an educated person to do it. Number one. That second thing is you cannot interfere with normal class hours. Usually you cannot interfere. So it can be done only in vacation time or on Sundays. Classes from a teacher, that's not possible. On the other hand, this SRS is easily done because puro gram asthina, sapoda gram asthina. But your National Family Health Survey is something like that. So National Family Health Survey, you need technical persons to fill it up. And it is again, shudu fill up korle hobe na. It has to be entered in the Excel sheet. That came later after the internet and all came. So he looked at, ki korte hobe? He should be what? Computer literate to some extent, he or she. So that questionnaire is also very long. Name of the house, father, the head of the family, wife, how many children are there, etc., etc. And socioeconomic status. And they are also including a lot of other things. Like for example, height, weight is there. So census height, weight is not there. This, the height, weight, then other things. They are also including how much internet, whether they know the internet. So based on the, and whether the person is anemic or not, based on this, we have some data which is called NFHS 1, NFHS 2, NFHS 3, NFHS 4, NFHS 5. NFHS 5 was the last one done after COVID. So that is the data which is very broad, but quite non-specific, because they're looking at things like anemia, they're looking at stunting, they're looking at wasting, they're looking at malnutrition, they're looking at literacy, they're looking at education. All these things are being looked at in the National Family Health Survey. Again, NFHS is only problem with the NFHS and SRS is that you cannot take the whole country, you are taking only a small group. Doshta village, Doshta city, Doshta gram, and you are making a study. So if the NFHS data, but they try to do it in some sort of random selection, but trying to cover as much as possible. For example, if somebody is doing an NFHS study in West Bengal, he will cover a district in North Bengal, he will cover a district in South Bengal, he will cover a village in the hills, he will cover a village near maybe Sundarbans or South 24 Progress to get a balanced thing. Okay? Because somebody comes straight to Darjeeling, does a survey, or Siliguri does a survey, that findings will be different from the findings in say, South 24 Pargana, because hill area and these people have a different thing. So they will try to take a representative of all areas, particularly in a state like West Bengal, which has got hills, mountains, and sea. So they try to take a representative, but it's not possible always. They take a small sample only and they extrapolate it. So based on that, sometimes the data may be interesting, sometimes it may be misleading also. Now suppose, how many of you from Siliguri? Siliguri থেকে কেউ আছে? North Bengal থেকে? Oh, একজন Siliguri. Nobody else? Kalimpong district? No. Kalimpong district হয়ে গেছে? Kalimpong is a district, no? No. So suppose you do let me ask a Siliguri girl. Suppose you do a study on height and weight in North Bengal, in Siliguri. What will you find? Bolo. What do you expect to find? Height and weight in Siliguri. What do you expect to find? I'm just asking you, I don't know. Specifically Darjeeling. Siliguri will have Darjeeling. What do you expect to find? Huh? What do you expect? Rocheta. Not for Rocheta. What do you expect to find regarding height if it is done only in Darjeeling? Huh? What is if a study is done in Darjeeling only? And what is it expected? What will you get the height expected the height to be? Huh? You're saying average. Anybody else? If I say it's slightly short, then what would you say? It's a bit short. Okay. People in the hills, proper hill people, I'm talking to tribal people, the Nepalis and all these people, they are actually a bit short. But if you take, say, because you do study only over there, you say that all of Bengal is having short height, that's not correct. That is why it has to be inclusive of all areas. I just give the example of Darjeeling because, obviously, similarly, if you go to tribal area, you find that Santals, they are slightly shorter height. You might also find that they look unhealthy. Okay, but though they are able to run and play and all, they look unhealthy. So, to do the study, whether it's a DFHS or National Family Health Service survey, you have to take representative population. So, you can't just go to one village and do it and come back. But they will give you a choice, but they will tell you one village, one random village, and it's given by lots. So, one random village in say Birbhum, another village in say Howrah, another village in some other place, that way. So that you can compare. So it's not possible to do all the villages and it's not possible to do everything. But the point is, that is how it is done. A lot of data is coming and regularly you find NFHS data shows stunting in 15%, wasting in 10%. If you Google it, NFHS data Google kurle. So this is based on this. So the problem is that you cannot do it regularly for a long time. It's done in a short period. It is done using people with training, with specialized institutions like Institution of Population Studies or some sort of paramedical courses who know the thing. But again, you cannot do a study in the entire India or all the villages in India. You just have to take a sample. That sample is maybe representative of the thing, but that is the thing which is projected outside. Projected outside means Bill Gates Foundation or WHO, they say that India's nutrition is poor, India's this anemia is there, this is there, that is there. But they're taking only a small sample. It's not a very big sample. So that is the problem. Okay. So basically this, coming back to the main, unfortunately it's not there, I would have shown you slightly more. The census and the census is the main thing. It occurs once in 10 years. We have not had it in the last 1 year. And they look at, the form is very, very complicated. It will take a long time for a person to fill it. And somebody should be there in the house. If the house is locked, they are expected to come to the house again. Only after 3 times after it is not there, then only will they say that the person is not staying there. Okay. So based on that, we will know the census. So all of you are studying in the hostel. Somebody is there at home. They will tell you your son or daughter is in the hostel. So your name will be will be added. But if they are not there, your parents have gone out somewhere, census people come there, they are expected to visit again. It depends again. Probably in the house, found the house locked. Your parents have gone somewhere, they found the house locked, you are studying here. So their absence is 3 জন ছিল 3 জন নেই. So that is the importance of census. And census gives you an idea of the population, obviously the population, and what they're doing, what is the education qualification, occupation, sex, and literacy, all these things. Okay. In addition, they look at the illnesses which they have, and how much is the income, how much is the expenditure, whether the house is pakka, what you're doing right now in your field study. A bigger expansion of that is there in this, whether the house is pakka, whether the house is kacha, what about sanitation, what about other things. So based on that, we find that our things have improved. That is, we previously, there used to be open defecation. What is open defecation, Jana? Okay. What is open defecation? Huh? Khula jaga defecate korte. Previously it was that. Khula jaga gele you find people defecating. So now it's no longer there because people have become more aware. People have found, and we are building public toilets and things like that. So that is one thing. Similarly, we had this Swachh Bharat Abhiyan that has changed a lot of things as far as sanitation goes. And gradually we have gone to a level where we have become, you can say, a semi-industrialized country, or as good as, not as good, but coming up to say US, UK, and Western countries. So all this we need the census data. Then in between census, what happens is the sample registration system data, because the birth and death rate has become compulsory. Within 28 days, you have to register birth and death. So, and marriage also have become compulsory. You have to register the marriage. Even if you have a big marriage, you have to register it within so many days. So, birth rate, death rate are compulsory for reasons I told you, to know the population, death rate, to get the property. Birth certificate is important for getting admission to school. Based on that is your next thing. Your class 10, Madhyamik, ICSE, CBSE. That also I think your school, your date of birth is mentioned. Taito? Huh? Date of birth is mentioned. Then next is your, after till 15 years, your birth certificate is the main thing. Then comes your, in between comes your Aadhaar card, then your passport, driving license, all these things. So the birth certificate is the most important thing. Death certificate is important for, to make sure that the person is no longer there, his property gets transferred to somebody, he's got a lot of money, that money goes to sons or daughters. What is your death certificate? You have to produce a death certificate every level, at the bank, at the village office or whatever, this thing. So that is done by a group of people, again small groups, clusters, and that is done only in selected villages. After 6 months, that is again rechecked by a supervisor to find out whether there is any false data or so-called jali data in this, and then that is given. So, but again, it is not complete because only selected villages are given. And however, in between the 10 years, 10 years gap for census, this acts as a thing. You can know the birth rate and death rate in between, say mid-year, mid 5 years. Last one is the National Family Health Survey, which includes people coming in between, and they do surveys in specific areas on specific issues and include things like stunting, wasting, anemia, BMI, all these things are done. Okay. So you need more technical persons for that, not just teachers, Arto, Shikito log, who know something about medical and population studies. That again is an indicator, but it's not a full indicator because the whole state is not represented. You're taking 10 villages, 20 villages, 30 villages. That is not represented, but you cannot take the whole state at the time. So they say a study was conducted in West Bengal. In India, they found that West Bengal has got 10% of this. Haryana has got 10%, 12% of this. Tamil Nadu has got 10% of this. But that study is done only in a selected group. It's not like census where every house is covered. Okay. So that's all basically the basics about this thing. I'm sorry for this slide I couldn't show you. Maybe I'll show it to you next time. Thank you very much.